Will Grimsrud. Every day, 173 people in the United States alone dies of a drug overdose. This fact was provided by Howery Jalal, who has a PhD in health services research from the University of Minnesota in an article he made for the journal Science in 2019. We have all taken medicine to help us when we were sick, but you could soon become part of an ever-growing number of people who are sick because of their medicine. The Food and Drug Administration should do more to regulate the sale of prescription opioids. First, I will talk about why the opioid epidemic is a problem. Then I will discuss possible solutions to this problem. Now, let us start with the problem. There is an opioid epidemic in the United States. An opioid is classified as a substance that affects the opioid receptors in the brain to produce morphine-like effects. This fact was provided by the Centers for Disease Control and Prevention, which is the premier public health institute in the United States, in an article on their website titled Changes in Opioid Prescribing in the United States, posted on July 7, 2017. Opioids pose a larger threat to the public health of the United States than any other kind of drug. For example, opioids are the leading cause of drug overdoses in the United States. And that fact is provided by the United States Department of Health and Human Services, which is a national department dedicated to enhancing and protecting the health and well-being of all Americans, posted on their website on October 27, 2017. This fact led the United States government to declare the opioid crisis to be a national health emergency in 2017. Prescription drugs are a major contributor to this emergency because despite being the only regulated type of opioid, they are the third most lethal kind of drug in America. That is only being superseded by two other kinds of opioid. They are, in fact, 2 times as lethal as methamphetamines. And despite a decline in the amount of opioids prescribed since 2012, we still give out more than 3 times the amount of opioids that we did in the year 1999. Opioids are also a gateway drug because many people who use heroin and synthetic opioids like fentanyl, which are the 2 most lethal kinds of drugs in America, originally started out using prescription opioids. Now that we've discussed that there is a problem, I will outline some workable solutions. In order for the United States government to effectively combat the opioid epidemic in America, I believe that it should enforce these 3 important regulations. The first one being that a requirement that all prescription drugs are an abuse-resistant formulation of that drug, such as the abuse-resistant formulation of oxycodone that was released in 2010. That, after it was released, saw an immediate decline in the amount of past month abuse of that drug. This fact was provided by Theodore J. Cicero, a professor of psychiatry at Washington University, in a report he made for the JAMA Network Journal in March of 2015. However, there is a limit to what a reformation of a drug can accomplish, with about 30% of the people who took the abuse-resistant form of the drug going back to the addictive forms. Because of this, I believe we should implement this second regulation that I had, which was restricting what prescription drugs can be given as a prescription for, because there is a direct correlation with the amount of opioid prescribed and the amount of overdose deaths from said opioid. And that fact is provided by Christopher M. Jones, who has a master's in public health from the New York Medical College, in an article he wrote for the CDC in March of 2016. This was shown specifically with methadone between the years of 2002 and 2014. When there was an increase in methadone prescribed, there was an increase in methadone deaths. And when there was a decrease in the methadone prescribed, there was a decrease in deaths. And I believe implementing these 2 regulations would help greatly to combat this problem. But if we implemented my 3rd and final regulation, I think we could really start to work against this problem. And that is creating a national mandatory provider review process, which is essentially a series of tests for doctors to find out whether or not they are overprescribing certain drugs and if they are doing their job correctly. Instances of such processes have shown to reduce the amount of drugs prescribed by 8% and the amount of overdose deaths by 12% in the states that have these processes. This fact was provided by Deborah Dowell, who has a medical degree from Columbia University, in a report she made for the Health Affairs Journal in October of 2016. First, I talked about the problem of prescription opioids. Then I outlined possible solutions to that problem. The Food and Drug Administration should do more to regulate the sale of prescription drugs. Medicine is meant to save lives. It's time to stop letting it ruin them.
5